Hello, my lovely people. We are back again. 2 days ago, I promised you I'll come up with a different condition that is closely associated with uncontrolled type 2 diabetes. Remember, 2 days ago, we talked about some of the shocking complications of uncontrolled type 2 diabetes. And I promised you I'll come up with a condition that is actually a big issue as well at the moment. A lot of people are being diagnosed with this condition. What is this condition? It's none other than dementia stroke Alzheimer's disease. So people confuse dementia and Alzheimer's. Let me differentiate between the two, and I'm going to concentrate on Alzheimer's because that's the one that is related with this diabetes. Dementia is a brain disorder that affects the memory and personality and impairs reasoning. Dementia is a group of symptoms rather than one specific disorder. That's dementia. On the other hand, Alzheimer's is a general degeneration of the brain. The disease may start gradually but gets worse as it goes along. It can happen in middle or old age, and it's a fatal condition. Alzheimer's is the most common type of dementia, accounting for 60 to 80% of all dementia cases. What are the signs of Alzheimer's? And before I even go on, just to clarify, I'm just going to give you the basics, signs and symptoms of Alzheimer's, so that when you notice your relation having those kinds of symptoms, it's time for you to go and have them investigated. I'm not a specialist in that area. So I'm going to give you just the basic. I'm only creating awareness. So once you pick up any of these symptoms I'm going to list now, it's time for you to now go to brain specialists for them to investigate your relation, or whoever it is that you've noticed some of these signs and symptoms I'm going to list now. So just to say that we are going to I'm only creating awareness, some of the things that you should be watching out for, because once awareness is created and once you notice any of these things and you start checking them out on time, it will help a great deal. So I thought I needed to clear that before I continue. So what are the signs of Alzheimer's? The first thing you may notice is that the person will have trouble remembering new information. The person may start being disorientation around the area. They won't know, they get so confused. They have behavioral changes. You think, this is not like this person. What's going on? This is not like my dad or mom or whoever it may be. There's increased confusion about location, about time, about event. They keep mixing things up. They start having unfounded suspicions. They suspect everybody around them, especially their close relations. So just because the people around, and they start even accusing you of taking their things, or just suspecting you. Oh, don't go into my room. Oh, don't do this. Or they'll start guarding things, and you think, what's going on here? This is not like this person. And later symptoms are things like not being able to sleep properly, not being able to speak, and swallowing will be a problem, and walking around will be a problem. That's really later stages of it. But once you notice some of these symptoms I've mentioned, remember, first one is trouble remembering new information, disorientation, mood changes, behavioral changes, confusion about location, about time, about events, unfounded suspicions or accusations. This is the time alarm bells should start ringing. The person might be in denial. I mean, you may confront them and say, oh, this is not like yourself. You're doing this, you're doing that. They'll say, oh, don't be silly. I'm fine, or this and that. They will they'll try to be in denial. But you know them very well, and you know that this is not normal for them. So don't fall for that denial, or don't fall for them saying to you, oh, I'm okay. It's only my age. I'm getting a bit older. That's why I'm behaving like this. Remember, I said that some people as young as in their 30s and 40s are being diagnosed with Alzheimer's or even dementia. So it's no longer about being too old. So if the person, especially if this person has underlying condition, for example, diabetes, it's time for you to take the person to the specialist to be checked out. Because if it's noted on time, then the progression can be slowed. Unfortunately, there's no, I can't remember seeing any cure for Alzheimer's and dementia. But if it's noticed on time, there might be things they can do medication-wise and things. And even change of lifestyle, change of diet, change of chemicals that are putting into our body, detoxing and things like that. I've even heard some people talk about coconut oil, that it has helped their relatives with dementia or Alzheimer's. But it has to be pure, organic, raw coconut oil. So I've heard people giving testimony that it has worked for them. But the first thing is to get this checked out and picked up on time. Because if it's picked up at early stage, that's the only time some of these things may help. Because if it's delayed and they've gone into full-blown dementia or Alzheimer's, it will be difficult to reverse or to slow the progression because they've gone too far. So early detection is very important. I cannot overemphasize on that. Alzheimer's is a neurodegeneration of the brain. When we say that anything is neuro means brain. So it's a neurodegenerative condition, and research has no specific underlying cause for this condition. There's been a lot of research going on about this. Several research over the years suggest that adults with type 2 diabetes, though, have a higher risk of developing Alzheimer's. Those with diabetes are at higher risk of developing heart attack and strokes. And high blood glucose levels can cause bouts of inflammation, which puts stress on the blood vessels. Yes, it can put stress on the blood vessels, and these damaged blood vessels will may in turn result to Alzheimer's. You see how they are related. So that's why it's important. I can't overemphasize the need for blood sugar to be under control, because over time it will cause inflammation, which now puts stress on the blood vessels. Once the blood vessels is stressed, obviously is damaged, and the damaged vessels in turn will result to Alzheimer's. You can see how they are related. That's why, all in all, managing whatever condition, especially type 2 diabetes or type 1 diabetes, just doing what you've got to do. But I'm concentrating on type 2 diabetes because that's the one that you can actually do a lot with lifestyle change to be able to manage. Let me remove my sunshade now so you can see me as I'm concluding this discussion. So please, all I'm doing is creating awareness, things that we should be looking out for. And once we notice this in any of our relations or any of our friends or anybody at all that we know before, and we think, their behavior is changing, they are not normally like this, please take action. I'm going to quickly list those signs and symptoms again before I conclude. And that is trouble remembering new information, disorientation, mood changes, behavioral changes, increased confusion about their location, about time and events, unfounded suspicions. Once these things starts coming, alarm bell starts ringing, get them checked out so that progression of this dreadful disease can be slowed down. And then obviously do other things you can, detoxing, changing your lifestyle, changing what you eat and stuff like that. And of course, pray. But praying without doing any of these things will not help. That is very true. Pray, but also take action. Thank you so much for listening. I'm going to stop you here. I've given the awareness. You don't need to know a lot more than what I've just said now for now. And once you've investigated and diagnosed, the specialist will take over the management from there and tell you and your relatives the best thing to do to be able to manage this condition. Thank you so much once again. Please share this video out, and I'll see you in my next one. God bless you, and goodbye.